I'm sure you've heard of meningitis, which is inflammation of the meninges. We have coverings over our spinal cord and brain called meninges, and it's 3 layers. The outermost layer is the dura mater, which is the tough mother. So you can imagine that that's quite a tough material, strong material. The middle layer is the arachnoid mater. Perhaps you're a fan of arachnophobia on the Sci-Fi Channel, and that's all about spiders. So the arachnoid mater is a web-like layer. And then the innermost is very delicate. The pia mater adheres directly to the spinal cord and up in the brain directly to the brain. So our nervous tissue is quite delicate and needs some support, protection, and the meninges do provide physical stability to the cord, also shock absorption, as well as nutrient and gas supply. The outermost covering is the dura mater, and it's tough because it's dense collagen fibers, the strongest protein in the body, and these fibers will run up and down, that is, along the longitudinal axis of the spinal cord. The arachnoid mater, the middle layer, includes the arachnoid membrane, which is just a layer of simple squamous epithelium, and then there is a space below the arachnoid mater, and that is the subarachnoid space. So that's between the arachnoid mater and the pia mater. And then the pia mater is the innermost meningeal layer with elastic and collagen, and this is adhering directly on the spinal cord. So there are some spaces, and look at the word subarachnoid. Epi is on top of. So the subarachnoid space is below the arachnoid mater. It contains arachnoid trabeculae, collagen and elastic fibers, and these are going to anchor the arachnoid mater to the pia mater. And this space contains our cerebral spinal fluid. This fluid, as you know, is a shock absorber and allows for diffusion of gases and nutrients. And then blood vessels for the spinal cord are here as well. And then epidural outside the dura mater, so it's between the dura mater and the vertebrae. And this contains areolar tissue, blood vessels, and adipose tissue. So you can see that adipose tissue here. Okay, so there's our spinal cord. We recognize that because of the butterfly in it. We recognize that this is the posterior side of the spinal cord because this is the spinous process of the vertebrae. So you can see the innermost right on the spinal cord is the pia mater, and then the space, the subarachnoid space, then the arachnoid mater, then the dura mater, and there's some adipose tissue. There are ligaments that help maintain the position of the spinal cord, the denticulate ligaments. So if you look at this picture, see that tiny little bit of material right there? This ligament goes from the pia mater through the arachnoid mater to the dura mater, and this is preventing sideways movement of that spinal cord. There are also superior and inferior connections to prevent up and down movement of that spinal cord. A lumbar puncture is called a spinal tap, and the purpose of this procedure is to withdraw cerebral spinal fluid. And so a needle, and you can see on the picture on the right, this needle right here, it's inserted into the subarachnoid space to take that sample. It's going to be below the conus medullaris. We don't want to hit the spinal cord. Which of these forms a boundary for both the subarachnoid space and the subdural space? That would be the arachnoid mater.